Hello, everyone. I'm Jeffrey Walt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Recently, Chain Drug Review teamed up with Kearney and Nestlé Health Science to present Together in the Fight for Health Equity. The day-long event brought together leading retailers and other experts to examine the problem and what can be done to alleviate it. Over the course of the next few days, we'll bring you some highlights from the event. Among those you'll hear from are Persaud of Rite Aid, Rina Shah of Walgreens, Marc Watkins of Kroger, and Jennifer Zilka of Good Neighbor Pharmacy. Today, we'll begin with insights from Warren Moore, Vice President of Social Determinants of Health Actions at Walmart.
Yeah, anytime I start these talks, I like to frame it up so you can understand how we're trying to approach this holistically as a company. So we know that when you talk about health, health starts before you ever get to a pharmacy, a doctor's office, a hospital. It starts more upstream than that. And so when you think about it, that gave rise to this business, social determinants of health, because we did, as we began to dig in, we found that 40% of your health outcomes depend on your social and economic status. Another 30% depends on the health behaviors that you engage in or don't engage in, right? And another 10% is on your environment. So that's 80% of your health outcomes are outside of the access or the quality of care that you get. And that 20% that makes that up is still important. We know that our pharmacists are on the front line, and we have a lot of healthcare professionals that do. So we know that we need to make sure that they're culturally competent and that they're culturally intelligent and they practice cultural humility. So we've done health equity summits, and we'll create CE and CME for all of our frontline associates so that we can train them that way. When we go into communities like here in Chicago, we're testing concepts like our community academy, where we are giving life skills for 16 and under for free. We're giving trade skills for 18 and over for free. I should say 16 and over for life skills, and 18 and over for trade skills, because we want to help build community. So we're trying to take this approach of how we look at associates, how we train and educate, how we make sure that we actually focus on the things where individuals give us permission to do so. And we're doing that. We know that it takes commitment. We know that it takes partnerships. We know that it takes, you have to listen to the communities that you're in. And so we have, if you look at Walmart and Sam's Club, about 5,100 stores, 4,000 of those stores are in medically underserved areas. And so we say, okay, what can you start doing today with our leaders and our pharmacists on how they can lean in? I think the first is being very good at starting to understand gaps for the patient. So sometimes it can be transportation, sometimes it can be literacy. So how do you start today with a mindset of understanding the gaps of the patient that you see? We think that there's this component of cultural concordance, right? So again, having practitioners that look like the community, that can relate to the community. I think it's incumbent upon all of our companies to do that, to make sure that we have pharmacists that are able to do that. I think from a health literacy standpoint, how do you communicate and make sure you get things across in a fifth grade type reading level, right? So how do we actually create that level of communication as we go there? And then understanding cost, I think is always going to be a barrier. So what are the ways that we can see individuals? Don't make a judgment before you get to talk to them about the care, because we see that a lot today around bias, where there's certain care that's not offered to certain races. So don't do that, but understand what costs come into play, how you can actually impact costs. But we also know that when I go back to those statistics, we spend 88% of our healthcare dollars on the 20%, not on that 80% that impacts your health. So how do we actually begin to have insurers and payers, and we have enough proof points and insights to move that payment more on the preventative side, which is going to be a big challenge. I'll tell you all this. So as we learn on this journey, I was talking to a regional Medicare payer, and I asked the question. I said, if it came down to growing your membership or the outcomes of your patients, which one would win out? And she was honest with me, and she said it was membership. Okay. So when you think about all of the SSBCI benefits that are out there, things that will be done, today is done to grow membership. What we need to do is get and innovate and change that mindset so it's spent on health outcomes. I'll tell you, as part of my team that's being stood up, or that has been stood up around social determinants of health, I hired a lady whose role is community health equity and relationships. And so that role is to look at how we possibly can have community health workers back in our stores as well. That's a connection, but also build connections on the ground with community-based organizations so that as we see things that, again, we're going to be good at what we can be good at, and you need the partnerships with community-based organizations that we can refer out and then hopefully close that loop as well. So we're looking at how we have entities in the store as well as refer back to community-based organizations and partner along. And then obviously our philanthropy group, we've been doing a lot in this work that we've been doing. We committed $100 million over 5 years to actually impact those 4 systems I talked about. And so here in Chicago alone, we partnered with Bernard J. Tyson Fund around giving to entities that are trying to do food initiatives within communities of color, et cetera. So lots going on in the space, multifaceted again, one piece at a time, probably not moving fast enough as everybody wants, but know that it's in a mind of us in our company as well. Healthcare professionals got into the profession to help people, so you get more of a pull from the front line. I actually think the real part of this is how do you get the middle of the organization committed to it. And I won't say that we haven't figured out, but I'll tell you what we're trying to do. I mentioned earlier on that we had health summit, so that was really for us to come out and talk around, okay, the what and why. So what is health equity, get into the actual official definitions around it. And then what does it look like when the social determinants of health work in a community and they don't work, going back to the life expectancy gap, and really try to paint that picture. We talked about trust and gave how customers trust pharmacists. So we really created that, and from those summits, we've chopped those up into bite-sized videos that live on our intranet for our teams to access it. The other thing that we've done in this phase is that we have a way that we recognize behaviors that we want our teams to do when it comes to caring for the customers, like you mentioned. And so now we've embedded that around health equity within that framework as well. So again, it shows up with how we do.